Henry Ford Kingswood Hospital is an integral part of the Henry Ford Health System, providing inpatient psychiatric care to our community members most at need. I really appreciate our ability to have smaller units that provide safe care for our patients, safe place for our staff to work, and really provide the amazing service to our community that they deserve.
We ensure that all of our employees are provided with the knowledge, the skill to provide safe, quality care. So we have a lot of good partners here. We have our nurses, our other BHTs, our social workers, our activity directors, who are all here to help the patient in any way we can.
I would like to say that I think that Kingswood is probably the best place if you want to do behavioral health. We have lots of people here who have been doing behavioral health for a long time, so you will definitely get the support that you need to start your journey in behavioral health.
There is no I in teamwork. Everybody knows this. If I did not have my team, the whole place would fall apart. It's always good to have someone else there to help you through it because they might have other knowledge that you don't have.
We offer an extensive orientation. Once you get out of orientation, everyone that you work with is here and ready and able to help you along the way.
Self-development, career development, always, these opportunities are always there for the taking. My superiors helped me get to my position by giving me the feedback that was necessary for me to build my skills as a leader as well as a nurse.
A typical night for us would look like coming in and starting off our evening with receiving a report from the day shift staff so that we know more about our patients individually and we can best help serve their needs. After we get onto the floor, at that point it's more about getting vitals, getting patients what they need, passing out snack, helping the nurses.
Rounding on the unit is safety checks. We have to make sure that everybody is safe and sound on the unit, make sure they're not hurting themselves or smuggling in contraband. It's actually nice to make sure that you're doing it nice and quietly to not disturb them, especially when they're sleeping.
So Henry Ford helps us with the challenging patients by making sure that staff and all BHTs are fully trained. We have our program called WELL, which is to help us with physical altercations. We have people that teach us about de-escalation. We have our duress badges in case we do get to a situation that we do need help or intervention on.
Another challenge is if we're trying to get a patient to take certain medications. You know, a lot of them come in here, I'm not taking this medication, yada, yada, and they really need it. And so we really have to really talk to them to get them to take this medication and understand once they take it, it's better for them. Other skills you're going to need is that you're going to need to learn how to be able to talk someone down from something, and it's all about your pitch and your voice and your tones and your body language, because you might not understand, you could do something that could be threatening to them. So you have to be mindful of your body language, your voice, your volume, and how you do things like that.
All of our patients are up and about, and you get to interact with them more, and it's more rewarding because you get to see results in a short time.
And then as the day progresses, you see them get better. You know, they might not understand why they need to be here, but you know why they need to be here, and so you work with them, and then I guess the end result is that they get better. I like people, I do, and I like what I do.
The ability to help people, that's actually why I signed up for the position, and help them get back to their families.